Okay, hi everyone, it's Janelle Parkinson. So I'm doing my presentation on fluoride. So what is fluoride? Fluoride is a chemical ion of the element fluorine. It's a naturally occurring mineral. It's a non-essential nutrient, so it means all basic body functions can occur without it. It does not have a function in metabolism. Where is fluoride found? Fluoride is found naturally in the soil, in rocks, and in water. There are two ways that water is a good source of fluoride. It's either in the public water that is fluoridated by man, or there is natural water that is fluoridated naturally, that's such as water that's provided through wells. Fluoride is also found in tea, in seafood, and seaweed. And most dental products contain fluoride, such as toothpaste and mouthwash, but not all of them do. It will say on the label if it contains fluoride or not. I am a dental hygienist. I started dental hygiene school back in 2011, and I've been practicing dental hygiene since I graduated in 2013. I'm in no way an expert of fluoride, and I don't claim to be, but I have been studying it for the past 7 years and been working with it through different clinical environments. And so I have really good experience with it. I am an advocate for the use of fluoride and to help prevent dental caries, and I would like to explain why I feel this way. So the function of fluoride is to protect teeth against the development of dental caries, which are also known as cavities. So this diagram over here kind of briefly explains how cavities are formed. So there's bacteria that's constantly in your mouth. It's on your teeth, in your gums, on your tongue, your cheeks, everywhere. So if we don't brush and floss properly, this bacteria grows and becomes a huge problem. And as we eat, these bacteria feed off the sugars from the carbohydrates we eat, such as candy, pasta, breads, crackers, etc. And as bacteria eat the sugars, they produce acids that sit on your tooth. And every time we eat, there's about a 20-minute acid attack on the tooth, or all of your teeth. And these acids work hard to fight through the tooth and leaving behind decay. So in this picture, it kind of demonstrates that. You have all that bacteria that's resting in your mouth come across these food debris. As they're digesting the food debris, leaves behind acids, and those acids basically wreak havoc on your tooth. As you can see over here, it goes through the different layers of your tooth. So it starts on the outermost layer, and if that acid attack is strong enough and long enough, it can seep through your tooth, through the different layers, and even get down to the pulp and in your root canals, which causes a big problem, as you can imagine. So how then does fluoride protect our teeth? Fluoride protects our teeth in two different ways, both systemically, meaning the fluoride that's ingested, and topically, which is the fluoride that's placed directly on your teeth. So systemically, fluoride is taken from the diet as teeth form to help build strong enamel, which is the white part of your tooth that you see, or all of your teeth that you see in your mouth. That enamel is actually stronger than bone, and it's what protects your teeth from decay. And that is where most of those acid attacks occur. So when enamel forms properly with help of fluoride, it's able to fight off decay more effectively because that enamel is strong enough to fight off that acid attack. Topically, the fluoride is placed on your teeth, and when acids attack the teeth, they weaken the enamel. And so when fluoride is available, it can help remineralize those areas by bonding with calcium and phosphorus to create fluoroapatite. And fluoroapatite is even stronger than the enamel that existed before, which is, you can see from this little cartoon down here. So you have an acid attack that causes demineralization of your tooth. So in comes the fluoride, it remineralizes those areas. So it turns the hydroxyapatite that exists in the enamel into fluoroapatite. So it's harder than the original tooth surface. It's more resistant to decay, and it reduces acid production by bacteria. And so you can find these topical ways of getting fluoride through your toothpaste, through your mouthwash, through water that's treated with fluoride, or the natural fluoridated water, and also the fluoride treatments from dental offices, which I included a picture of. I don't know if you guys Have you ever had that foam treatment in your mouth at the dental office, which is the fluoride treatment? And now most dental offices that I have been working with use this varnish fluoride. It's just painted directly onto teeth. It stays on for however many hours during the day. And it's just a good way to provide that fluoride to the tooth. So the dietary needs for fluoride, these are all based on the amount needed to prevent dental caries without causing mottling of the tooth enamel. And I'll talk about what mottling means. But the adequate intakes are 3 milligrams a day for women, 4 milligrams a day for men. And then for infants that are younger than 6 months, it's only 0.01 milligrams a day. And the reason why really young kids, even if they don't have teeth, need fluoride is because those teeth are forming under the gums that you just can't see. And so that fluoride is necessary to help make that enamel stronger. So when kids are 6 to 12 months of age, they need 0.5 milligram a day. And then for the young children to adolescents, it's anywhere from 0.7 to 3 milligrams a day. Then the upper level for infants and children is based on, well, infants and children up to 8 years of old. The upper level is based on their body weight. So it's 0.1 milligrams per kilogram of their body weight. And then once they're 8 years and older, it's 10 milligrams a day. And that's the upper level. So I wanted to include this chart. This is something I have used many times in the dental clinic and explaining this to parents especially. So this is how much fluoride is recommended per person for child, really, from birth until they're 16 years. And that is because systemically, fluoride is basically only necessary systemically when teeth are forming in the mouth. So that occurs up to your 16 years of old when your wisdom teeth are still forming. And this chart is based on how much fluoride is in your water source. So if your water source is providing 0.3 parts per million of fluoride, then you don't need any supplementation for any babies that are up to 6 months old. Once they're 6 months to 3 years, it's 0.25 milligrams a day. 3 to 6 years, it's 0.5 milligrams a day. And 6 to 16 years is 1 milligram per day. And so then if you continue to look, if your water source provides 0.3 to 0.6 parts per million, then you can, based off the age, determine how many milligrams of fluoride your child should be getting. But if your water source is more than 0.6 parts per million, then no supplementation is needed. The tricky part about this is knowing exactly how much fluoride is actually in your water source. I came across this from the CDC. I will post my PowerPoint also in case anyone is interested in looking at these resources. But if you visit this website, the CDC has this interactive map. So you choose which state you live in, and then you can choose the county you live in, and it will tell you how much fluoride is in your water. So that way you can determine how much fluoride you and your children are receiving, and if there's supplementation that is needed or not. Okay, so dental fluorosis or mottling is the result of excess fluoride in the enamel while your teeth are forming. So they're seen as both white and brown spots or streaks on your enamel, and although they're not aesthetically pleasing, they do not bring any health risks with them. And so you can see in these pictures what normal teeth look like. The mild has the white marks on the bottom, and moderate you can see more of those white streaks, and then the severe is the brown spots. And that brown spots, those mottling spots, is actually what made people more aware of the effect fluoride has on teeth. It was back in 1830s, dentists came across a community that received their water from a well, and almost everyone had these brown spots on their teeth. And so they looked like they were infected, but as they continued to work on the teeth, they didn't find decay. And so even though that mottling maybe doesn't look good, your teeth are still really healthy, and it's actually even healthier because it has all the fluoride in it and it's really strong. But so much research because of that finding in the 30s has been done to determine the right amounts of fluoride that won't cause that mottling in your teeth. So there is no specific disease or disorder that exists from insufficient fluoride intake. So there are no known deficiency problems. There is, of course, an association between the increase of dental caries with the lack of fluoride. So more fluoride equals less decay. Toxicity can occur. It is very rare though. And so it's always important to monitor children when they're using the fluoridated dental products, because they tend to swallow their toothpaste or their mouthwash and they don't know how to spit correctly. So if too much is ingested, then acute toxicity can occur. And signs of toxicity include nausea, vomiting, diarrhea, sweating, spasms, convulsions, and coma. So the most interesting thing I have learned throughout my years of working with fluoride and working with patients is how many people are against fluoridation in general, but also fluoridating the water system. There are so many people, even in our country, who do not have adequate dental care. Many people don't have dental insurance. They can't afford getting their teeth cleaned. They can't go in for their 6 months checkups. And so they're, especially kids who are suffering. So fluoridating the water is a safe, excuse me, and very cost-effective way to provide everyone with a beneficial amount of fluoride. Now, if you were to do some research on your own to look up water fluoridation, you're going to find many of these websites that don't have good, they don't have really good resources, but they say these scary things about fluoride and how bad it is for you. But I just wanted to talk a little bit about the safety of it, of water fluoridation. So the fluoride that's added to the water is at a level of 1 part per million. And to put that into perspective, it's approximately equal to a single drop of fluoride added to a bathtub full of water. So if you think of, all these people are worried about the toxic amounts of fluoride that they can ingest. If you were to ingest enough fluoridated water that the fluoride would kill you, you drink so much water that the water would kill you first. So it's really a very safe way to fluoridate the water. It's a very safe way to give fluoride to everybody and to help all those people who really are at a disadvantage, and to help them protect their teeth. My highlight from the media is what I came across from the American Dental Association. Has incredible resources about fluoride with educational videos, frequently asked questions, and they even have a link to a 114-page booklet all about fluoridation, all about its effectiveness, its safety, its history, and more. So if you have questions about fluoride, you can check out that website. And again, I'll post this PowerPoint so people can so you guys can get these resources if you're interested. So in conclusion, fluoride is a natural occurring mineral that is very beneficial in prevention of tooth decay. Use toothpaste and mouthwashes that have fluoride in them, but use them as directed and keep them out of reach of small children. Monitor all the children who are using them to prevent overconsumption. So teach them to spit correctly. Talk with your dentist or your dental hygienist about you and especially your children's needs for fluoride. Determine how much fluoride is in your water source to be sure adequate fluoride amounts are being consumed. And these are the sources that I used. And thanks for listening.